to the presentations in your own language by clicking on the globe and selecting your language. Dr. Andres de Francisco is the director of the Department of Family Health Promotion and Life course of the Pan American Health Organization. In the name of our organization, he's going to be officially in charge of opening the event. So, Dr. De Francisco. Thank you. Thank you, Rodolfo. Dear colleagues of WHO and of CLAP, ladies and gentlemen, attending the session, in the name of the Pan American Health Organization, I want to give you a warm welcome to this important event where we are launching the family planning courses for the first level of care and the immediate post-obstetric event contraception. We are very happy to be with all of you today. I'm sure that we're going to have a spectacular meeting. The access to contraception and the assurance that the demand of family planning can be met using effective contraceptive methods is essential to succeed in providing universal access to the services of reproductive health as required in the sustainable Agenda 2030, because it is included in the conference adopted by 179 governments in El Cairo in Egypt in 1994. The action plan was recognized the basic right of all the couples and individuals to decide responsibly the number, the spacing, and the timing for bearing children, and having the information and the means to do that, as well as the right to achieve the highest level of sexual and reproductive health. Although since 1994 to date, a lot of progress has been made in contraception, the contraception field. There are still significant challenges, especially quite remarkable in some countries in the region. Those challenges have actually increased since the beginning of the pandemic of COVID-19 that we are currently living. Many of the 17 SDGs and 179 targets of the 2030 agenda are related with the empowerment of women and children, gender equity, and health. Although family planning is important to reach most of the objectives, there are specific references to family planning in SDG 3 and 5 related to the promotion of equality among genders and the empowering of women and girls. The department that I chair, Family Promotion of Life and Course of Life of the Pan American Health Organization, we celebrate this initiative by CLAP WR, a key element of the department, given the significant lag that the region will have in the field of meeting the needs with modern methods. We estimate that it will go backwards 20 to 30 years. And so it's very important to consider the role that these courses that we are launching today will have. This gives information on the 21 modern methods proposed by the WHO in their family planning manual in a very didactic and innovative method. It's a very good thing, but it's not enough unless we can really meet the needs with the informed demand of clients. The characteristic of the institutional parts that, although impaired or affected by the pandemic, this gives us a unique opportunity for the clients to access the health care sector, which we must ensure to provide access to a long-lasting and reversible method of contraception if the woman is willing to have one. And we're going to see the details. Now, let me congratulate the team of Clapper, Suzanne Sarruya, the director, who has been working hard to develop the courses that we are presenting today. Finally, we wanted to reduce the unmet need for contraception. This is a task that we are all concerned in. So I celebrate the participation of the many participants, universities, ministries of health and development in the region that are in charge of this topic locally. We hope the courses to be of great use. Please use them. Please disseminate them in your networks because they're really worth it. So thank you. And I give the floor back to Rodolfo. Thank you, Dr. De Francisco. So with this, we open the event. We will have 3 very brief presentations, and then we are going to have a panel where we'll have a chance to listen to the leaders discussing family planning. We have over 500 people in the Zoom room, and this is also being streamed through YouTube. So we want to welcome the first presentation by Dr. Ian Askew, who will present in the name of the WHO and the Department of Sexual and Reproductive Health and Research. Is going to give us a talk on the aspects that family planning. Could you please put the slide describing Dr. Ian Askew's resume? We're going to have a chance to listen to Ian. Ian will talk about the advances of family planning and its relation with development, but also in the protection of rights, very especially the reduction of inequalities and the development of the countries. So we are very happy to listen to Dr. Ian Askew. Ian, please go ahead.
Well, thank you very much indeed, Rodolfo and Andres, for your presentation and for your introduction and your kind words. It's a real honor and pleasure to be with everyone here. We have a huge audience, and I'm hoping that everyone can benefit from the training sessions that are going to be coming forwards. I've been asked to just say a few words about the importance of family planning, why we are promoting it very strongly, particularly at this point in time, the multiple benefits that can be brought by promoting and making available a wide range and choice of contraceptive methods through family planning programs. I have a small number of slides, so let me just try and share those on the screen with you. First, it's important to propose and to present family planning within the broader context of the Sustainable Development Goals. As you're all very well aware, the Sustainable Development Goals have been universally adopted globally. They've been in place now for 6 years and will continue to guide overall development by countries and regions for the next decade through to 2030. What I'm showing on slide here is the centrality of family planning to national sustainable development goals. The ones I've put up here, number 1, 2, 3, 4, 5, 8, 12, 13, 16. These indicate some of the many SDGs that family planning can directly benefit by offering women and couples the possibilities of controlling their fertility. It's not just a health issue. Most people, when they think of family planning, will think of SDG 3, good health and well-being. And certainly that's a major reason for providing family planning services. But without family planning services being widely available and a good choice and selection being made available of contraceptive methods, many of the other SDGs that countries strive to reach will struggle to be achieved without family planning being there. For example, SDG number 1, about eliminating poverty. Poverty is often caused by insufficient resources being available, by people not being able to be employed in sustainable ways. And family planning can enable countries to make sure that there's a sustainable balance between population growth and the human and the economic and natural resources available. Likewise, for hunger, trying to get the global hunger goals down to 0 so that no one goes hungry. Again, family planning can influence this by making sure that people are able to have the number of children and the family size that can be supported and that they can have the food needed to ensure a nutritious and balanced diet and growing up in a with full development. So I wanted to show this slide to try to bring across the point that although family planning is primarily proposed through the health sector, it has major implications for many of the other sustainable development goals that countries seek to achieve. From an economic perspective, many analyses have been undertaken to look at the benefits, return on investment, as economists will say, for countries to invest in family planning programs. And one of the better known analyses has shown that for every dollar invested in meeting the unmet need for contraceptives can yield around $120 in the long term in annual benefits. These can include some of the benefits from reduced infant and maternal mortality and benefits in the longer term economic growth that is possible through the achievement of the various SDGs that I showed in the previous slide. So if there's a need to make a case for to the ministries of finance in your countries on the economic importance of investing in family planning, the data are there very clearly showing that from a health economics perspective, it is probably one of the most beneficial investments that a government can make in part of its economic development plans. Secondly, and you heard this from Andreas, it's really important to bear in mind that family planning is essentially a means for countries to enable their citizens to achieve their human rights, and specifically their right to decide freely and responsibly the number, spacing, and timing of their children, and to have the information, education, and means to do so, and the right to attain the highest standard of sexual and reproductive health. Human rights are at the core of all healthcare, and especially for family planning. It's critically important that any family planning program and the contraceptive services offered are done so from a human rights perspective. And the key human right that we're looking at here and that countries need to adhere to is that the family planning services will enable individuals and couples to make these decisions freely, responsibly, and in the best interests of themselves, of their family, and of their community. The next point I wanted to raise, again, was mentioned by Andres, and it's a very important one. One of the key SDGs is SDG number 5 on achieving gender equality. And family planning services are one of the main mechanisms through which adolescent girls and women can be empowered and to therefore build and improve gender equality in a country. I'm highlighting here 3 approaches, although there may well be others, that family planning enables women and girls to make strategic life choices that will contribute towards achieving gender equality. First, by having access to and using contraceptive services, it gives women and girls bodily autonomy, gives them control over their own bodies, and enables them to make the decisions that they feel are best for them. Related to this, it enables control over family size and the intervals between births. And thirdly, by avoiding unintended pregnancies and unwanted births, it provides opportunities for achieving educational goals, for being gainfully employed, and for using these two opportunities to really be empowered and be active and equal members of society. Moving on now to the health benefits of family planning. As I said at the beginning, family planning is primarily considered to be a health service. And so when we look at the reasons for the health benefits beyond enabling individuals and couples to plan their families, to determine the spacing between births, there are a number of other health benefits that practicing family planning can offer. First, it can reduce maternal mortality and morbidity by first preventing unintended pregnancies, and particularly pregnancies that may be high risk and could lead to either the death of the mother or lifelong morbidities. Secondly, it can reduce the number of unwanted births and the complications throughout life that may lead to. And thirdly, we know that approximately half of unintended pregnancies are ended in an abortion. And we know that half of those abortions are often unsafe. And unsafe abortions can lead to morbidities and mortalities. And so being enabled to access contraceptive services will also reduce the number of unsafe abortions and the problems that go with those. Secondly, contraceptive services offered through family planning programs can also help to reduce neonatal, infant, and child mortality, primarily through two mechanisms. First, by increasing the interpregnancy intervals, which can lead to longer breastfeeding and better infant nutrition. And secondly, generally speaking, the health of the mothers will be improved as well, and this will lead to reduced risk of stillbirths and of low birth weight babies. So many health benefits of using family planning generally, in addition to the issues I'd raised previously. Also, and I won't go into this into detail, but just you can see by the number of bullets on the screen, this is an important issue. Many of the contraceptive methods that WHO recommends have other health benefits associated with them. So for example, we'll take the first one there. If we look at combined oral contraceptives, many of these will reduce risks of endometrial cancer, cancer of the ovary, symptomatic pelvic inflammatory disease. It offers protection against ovarian cysts and iron deficiency anemia, and so on. So if we're looking at the different methods here, and you'll hear more about these, I understand, in the training course, each one also offers additional health benefits, which for many women can be extremely helpful and improve their overall health status and the well-being throughout their lives. But, and we've heard this and we'll hear a lot more about this in the training program, there remains a large unmet need for family planning. And I've put up here the definition of unmet need that is globally used. It's the percentage of fecund women of reproductive age who want no more children or to postpone having the next child, but who are not using a contraceptive method, plus women who are currently using a traditional method of family planning. I put this definition up here because, as the next and my last slide will show, if all unmet need for modern contraceptive were to be satisfied in low and middle income country regions, and all women were to receive care at the standards recommended by the WHO, the impacts would be really dramatic. As you can see in the graph on the right-hand side and is given in the bullets here, if every woman was using a contraceptive method of her choice, unintended pregnancies would drop by 68%, unsafe abortions would drop by 72%, and maternal deaths would drop by 62%. So with these statistics, it's hard to see why anyone would oppose modern contraception or try to reduce access to modern contraception. And certainly within WHO's promotion of universal health coverage, Access to contraceptive services is right at the center of all of our proposals and programming and recommendations around universal health coverage. We really do believe that countries should make family planning services central to their universal health coverage approaches. So with that, I'd like to thank you for your attention and hope that that provides a brief overview from a high level of some of the reasons why we believe that promoting family planning and making contraceptive services available to everyone, everywhere when they need them, is a critically important aspect of national economic and social development goals. So with that, thank you very much for your attention, and I'll hand back to Rodolfo. Thank you, Rodolfo.
Thank you, Ian, for being so clear. I think the message is very clear and concise and easy to understand the potential effect and impact of family planning. Now I will introduce our next panelist, Dr. Suzanne Cerruja, a gynecologist and obstetrician. And it is a pleasure for us to have her as director in CLAP. She will discuss with us a more regional vision of all this. She will tell us what is occurring in Latin America and what is occurring particularly at critical times during the pandemic, and how this family planning that Dr. Ian Askew has detailed has such a great potential. Well, what is truly occurring? Dr. Suzanne Cerruja, the floor is yours. Good morning, everybody. I will start thanking everybody for being here, particularly Andres and Ian. Thank you so much. Both of you have contributed to have us speaking about these topics addressed particularly to Latin America. I want to repeat what Andres and Ian said so brilliantly regarding the benefits and interrelationships between contraception and the rest of the woman's sexual and reproductive life. We're aware of how important this is, but I want to begin discussing with you briefly what is the challenge we're facing in our region. And this is why the first thing I bring is something we've published in 2019. We were not aware of the pandemic, but we knew that this region has a median number of high contraception, but we have over 85% need of satisfied needs for contraception, but great inequality. Therefore, we wanted to consider how the modern methods, because as Ian just said, it's important to use those methods that are the ones we'll be working on basically in the courses we're starting today, and the importance of these. So when we reviewed all this database in 23 countries with a very high figure of women, over 200,000, you will see that, well, this is just to make you aware about the publication and the data and the conclusions reached. There is a huge difference among women in the highest quintile and the lowest quintile. In other words, in 2019, we thought that our first challenge or major challenge was to reduce inequality. This, of course, is still a major challenge. However, when today we look at that set of inequalities and place on the one hand that index of inequality, where we have those references and have national coverage of countries in the region,
and the qualities. So I believe that that is one of the topics that precisely we have to look at. We are going to work to improve the coverage and to reduce inequalities. That was our plan in 2019, and this unfortunately continues to be the case, and even more so now. WHO, since the pandemic started, together with PAHO and of course at the Latin American Center for Perinatology, monitored what was happening in the countries in terms of the interruption of reproductive, maternal, neonatal, children's and nutritional health. That is the package of essential services that whatever happens should never be interrupted dramatically. So we saw this in with different degrees. And if you look at the slide, you're going to see that precisely in family planning is where we see the most significant interruptions. And added to what Ian presented, in the region, we have a study, but we also have a global studies showing that there are cumulative effects because there's a reduction in the acquisition of methods in the private sector. There is a lack of supply. There are supply gaps in the public sector that have to do with logistic problems during the pandemic and resources that have been earmarked to address the pandemic, and a reduction of the demand in a certain sector of the public, because in many countries there were lockdowns, people circulated less and that was very significant. Now, with the business as usual, with no corrective measures, we can reach almost 2 million unplanned and unwanted pregnancies, with about 800,000 abortions, most of them not safe. And we would see an increase of maternal deaths almost by 3,000, close to 39,000 child deaths. So I want you to all please add to this, to where are we going to see, when we speak of inequalities, where are we going to see the deaths? Who are those women who are not acquiring their methods? And they are in the countries where we see that there are the greatest gaps. If we look at the study in the region by UNFPA, what could happen with the figures? We're going to see that we run the risk of, well, we used to have a number of 11.4. When I started using the average number of unmet needs in the region, it's low. It's low if we compare it versus other regions in the globe. So when we look at this, we see inequalities. However, at present, we have a forecast of we anticipate that we're going to go 20 years backwards. Now, that's the optimistic case. If we don't adopt the actions needed, we could go back 30 years. So more than ever, we have to continue to work to implement actions and to build a rationale of joint work logic, where we have a shared decision making with the need of having significant funding by the countries and donors, but essentially we need a response we need to be increasingly effective when we provide care. By no means, if we have a woman in front of us, we cannot fail in giving her the services. So immediate and the immediate post obstetric event contraception, if the woman is absolutely necessary, because you can provide the woman with an opportunity to space her children for 5 years, for instance, if you give them a long acting measure after they bear a child. So, and we need to consider then that we need to work based on recommendations. But today, the Latin American Center for Perinatology is very happy to announce the launching of very important courses, and I want to thank our Rodolfo Gomez, our regional advisor, who worked with a huge team with many partners to develop these two tools. These tools and others that are available would make it possible for at least to be able to increase our efficiency in a humane and good quality manner. So I wish you enjoy this meeting. Did you know that there are over 20 contraceptive methods? Do you know how important it is to space pregnancies after delivery or an abortion? These and other questions can be solved through the immediate post-obstetric event contraception and through family planning with many resources and videos and activities, and you'll be able to discover that contraception either after an obstetric event or at the beginning of your sexual reproductive health is a right to all women. Are you ready to dive into the courses, to have more tools and be able to provide advice to many women? Well, thanks a lot, Suzanne, for the presentation. Now we are going to share very quickly what is this all innovation about? What is this? What do we mean when we speak of family planning and immediate post-obstetric event contraception? There are many people who worked. I'm just going to mention two, but there were multiple people. Silvia Sorovic and Valeria Bahamondes were present working with us hand in hand, as well as many professional associations that are here with us today. And I also want to thank the company, that is Tercer Termino, that put the course together and did a very good job. So what do we all mean? Well, we took the family planning manual that is that targets the healthcare providers, because this manual has 25 chapters, and we transformed that into 3 courses, and the 3 courses are in the 3 languages with exactly the same contents, Portuguese, English, and Spanish, and simultaneously they are launched, and starting on July the 1st, you'll be able to record in any of these languages. So as soon as you enter the course, you're going to see a familiar face. We're going to greet you individually, and you'll be able to choose English, Spanish, or Portuguese, and we'll show you the contents. After the presentation of the course, we'll be able to follow the contents. This course on family planning for the first level of care has 27 small capsules that and you are going to be able to follow the contents of the manual. There are 2 new capsules that were included very recently in this manual, including family planning for women at risk or of getting HIV or living with HIV, and family planning during pandemics. The contents are in modules and can be followed sequentially. You are going to see how you move forward until when you complete the course. You can do it at your own pace, individually. You can do it in tablets or in mobiles or in computers. You can do it while you're on duty at the office, individually or in groups. So once you have completed the contents, you can even print some of the content if you prefer to study on hard copies and not electronically, but you can print your even from your mobile phones or your computer, you can read it again. All the modules have a small introduction where you're going to be told what the targets are for learning and what you'll be prepared to do. Let me give you an example. The 19th module speaks of coitus interruptus, and you'll see that you can monitor it, and you'll see the circle that gives you the degree of completion, 0%, 50%, 100%. Once the module has been completed, you can also go back and you can see the previous components. It gives you the messages. It's very interactive. It has short, brief videos that are highly motivational, and you even see interactive screens. You are going to see the screens. You'll be able to turn the cards, and it will make learning easier. And at the end, it will tell you that you're ready to go on. And at the end of the course, we are basically going to have 2 assessments. One is the assessment of the technical theoretical contents, and the other is an assessment, an evaluation of the quality of the course. Thanks to this evaluation, you'll be able to tell us whether the course was useful, whether it was beneficial for you, and if you have any recommendations. Now, once you complete the evaluation and that you pass with a significant percentage of correct answers, you are going to be issued a certificate signed by Dr. Carissa Etienne. Many of you asked in the chat whether you are going to be given a certification. Of course, you're going to receive a certification for those 14 hours that you'll be devoting to your training. These 14 hours will represent the content of the 27 capsules. Another course, the second course, let me briefly tell you what it's all about. It's highly focused to immediate post-obstetric event contraception. And the word immediate here is key, since it is given right after solving an incomplete abortion or a delivery, right after the delivery of the placenta. And this is for professionals that provide care.
These professionals will receive training with less modules, deeper, only 6. And these modules likewise will simultaneously be launched today in 3 languages, Spanish, Portuguese, and English, each with all contents and videos and exercises in the different languages as mentioned. This training has an interactive session for each module, and then at the end, an exam, and if it's passed, a certificate for completion of hands-off distance theoretical training. These modules and courses are in the online platform of PAHO, which is like an online university where you have many more options. But these are the two new members of our family we wanted to introduce to you. However, this course has the potential of being done together with CLAP and other professional organizations represented here today, PLASOC and FLOW, the Latin American Federation of Gynecologists and Obstetricians, and the Latin American Federation of Obstetricians, with a combination of expert tutors that will furthermore have a simulation phase at clinical level and simulation applying the method, and you'll receive a further certificate. So you have the hands-off initial sector, and then you could combine it with a second phase with preclinical and clinical simulation, with simulation models such as the one you're seeing here to place intrauterine devices. So thank you. I hope I have been able to guide you briefly through the contents of our two new courses, which we will share with you starting on the first working day next month, where you will be able to register in the links you have received and have totally available. Okay, now let's pass on to the second part of our presentation, and I would really like to introduce Milka Disnev. She is representing the Latin American Caribbean Forum, starting from a global initiative of contraception, care, and input, and she will discuss the work of the LAC Forum. Milka, a question. What would be the contribution of these courses towards the implementation that the LAC Forum has planned for family planning? The floor is yours, Milka. Thank you, Rodolfo, to you, and good morning, everybody. It's truly an honor to be with you today. The LAC Forum is a regional arm in Spanish of the Global Coalition for Reproductive Health Input. It's the largest organization in the world for input, and we gather governments, donors, and bilateral and multilateral organizations, manufacturers, civil society, and the academia in a joint effort to ensure availability of all contraceptives for men and women in the world. What the LAC Forum provides is a safe space so all parties could interact and work together. We work closely with WHO and PAHO in input, and likewise with the Population Fund. We have four main pillars of activity: quality of input, good quality, availability, freedom to choose the input that is most appropriate to the period of life, and equal access to input. We celebrate the launch of these courses, and we're engaged to disseminate them among all our members. We have over 600 members in the region, and therefore we will share all this with them. The mission of the LAC Forum is precisely to ensure that all individuals access to contraceptive methods that they can choose freely, and our work is focused on having them available. These family planning courses and IPOAC go well with the initial activities of the LAC Forum, and we work closely with 14 governments directly in order to improve public purchasing of contraceptive methods, and also with civil society to ensure that access to input be equal and affordable to all the population, particularly to those who are more vulnerable. We once again compliment CLAP and PAHO for this great contribution to the management of knowledge in our region. And we will continue working together as we've been doing so for many years. Thank you, Rodolfo. Thank you, Milka, for your warm words and renewing our commitment to work together. I will now introduce our next panelist, who represents the Latin American Federation of Obstetricians, Emma Schuller, an obstetrician from Argentina, that will share with us her view and reaction vis-a-vis this announcement. And as I said before, we are part of our main partners. And I wanted to tell you that we have over 800 people following this course with Zoom and the YouTube channels, both in Portuguese and English. Thank you for being with us. Emma, the floor is yours. Thank you. Good morning, everybody. I wanted to speak on behalf of Latin American Federation of Obstetricians and acknowledge and thank you for this initiative in CLAP, to thank Dr. Cerruja, Dr. Gomez, and the whole CLAP PAHO WHO team for this major initiative. The Latin American Federation of Obstetricians includes professional societies, that is, unions that gather different forms of what we call midwives, people with a degree in obstetricians, and likewise university societies, that is, schools of obstetricians, with the aim of strengthening professional midwifery in the region, thus contributing to sexual and reproductive health of the population with a focus on gender rights and interculturality. In this sense, midwives today are an essential human resource to achieve the ODS 3 and 5, that is, we are over 40,000 professionals in Latin America who are working to guarantee this universal access and reduce unsatisfied needs for family planning, particularly in the more vulnerable population. So in the Federation, we work and are grateful for this initiative that places its stakes to improve these aspects of availability. And when we speak of availability, we're not only referring to access and availability, access at geographic and economic and administrative level, but essentially that we as professional midwives may carry forward. And it's precisely social and cultural and symbolic, we would say, availability that is the reference when we speak of availability. In other words, we're professionals who are in this first level of care, in this close contact with women, with men and families, and in this sense, create representations. We may contribute in a positive way, generating availability and an understanding with the health system, or the opposite, generate representations that, according to users, are not understood. I won't attend because they don't listen to me. In that sense, in this course, we place our stakes in this training to empower obstetricians in know-how, but knowing how to be also. That is why it's so important to provide quality care in this first level of care to girls, boys, teenagers, adults, not only to access, but to sustain this close contact with the health system, guaranteeing follow-up and permanent counseling for their care when the initial contact is essential to determine this good intrapersonal relationship, and not only for them, but also in order to determine protective and risk factors for health and thus establish a follow-up plan. That is why this course that will echo quality training and generate an environment of privacy, confidentiality, appropriate language, and appropriate spaces so the users can account for free and informed and autonomous decisions. We place our stakes in the Federation to support and echo this course, not only for societies and colleges, but schools. It is there where people are trained, that is, to have teachers and qualified teachers is of essential importance. For that reason, we celebrate this course that sets a basis for the essence of the Latin American Federation of Obstetricians. Thank you for this initiative and my compliments once again. Thank you, Emma. We share your happiness and enthusiasm. Now, the next panelist will refer about the position of the Latin American Federation of Gynecology and Obstetricians. Dr. Luis Hernandez, on behalf of the board of LACSOP, will give their view in relation to this launch. Thank you, Emma. Welcome, Luis. Thank you, Rodolfo. Good morning, everybody. I am Luis Hernandez Guzman from Guatemala, a physician, and on behalf of the Executive Committee of the Latin American Federation of Societies of Obstetrics and Gynecology, we're very pleased to participate in this launch of the courses for family planning for the first level of care and for immediate post-obstetric event care. We're clearly aware of the unsatisfied needs for family planning in Latin America that were corroborated today in the presentations of the experts who spoke before me. The Latin American Federation of Societies of Obstetrics and Gynecology is an institution that gathers 19 federations or societies of gyneco-obstetricians in Latin America, and one of its goals has always been to care for reproductive health in Latin American women, and therefore we are very pleased with this excellent initiative of CLAP and PAHO throughout the past 6 years. FLACSO, through its Committee of Sexual and Reproductive Rights, has provided training to health staff in relation to sexual and reproductive rights and an improvement of the quality of sexual and reproductive rights in countries in Latin America. Furthermore, we have conducted seminars for health staff on experiences in depenalization of abortion in the different regions of FLACSOC and indeed in Latin America. Throughout this period, via the Committee of Infancy and Adolescence, we also conducted multinational research of emergency contraception to achieve consensus regarding contraception in teenagers under 14.
And 11,600 Latin American adolescents responded. So we reached a consensus. We could write a consensus for adolescents. At the last FLACSOC meeting preceding the current one, the Committee on Sexual and Reproductive Rights continued to work, and they drafted a project on contraception and sexual relations. And this work gave rise to the scientific research and the onset of sexual relations in adolescents under 15, an election or a coercion. And so this led to two surveys, one of them on the emergency contraception and the level of knowledge among adolescents, which was and all the associations were given guidelines to contribute to the ministries of health. They were given the manual for gynecological care in children, in girls and adolescents. So as international societies, we are constantly raising awareness and training and educating in our societies on issues of reproductive health. And of course, as a significant part of this, the issues that have to do with family planning. That is why we applaud the initiative and we welcome the launching of these courses by CLAPA and PAHO, and we made ourselves available to collaborate as a federation in whatever we can contribute with for the benefit and the well-being of women during their childbearing age. So we thank you for inviting us to participate in this very essential event. So we thank you for your attention. And of course, I repeat that our commitment to contribute with the organizers of these courses so that to ensure their success. Thank you, Rodolfo. Thank you, Luis. Thank you for those beautiful words that also renew our commitment of joint work. We want to mention all those that are requesting the link to register in the course. Well, each and all of you are going to receive an individual and personal invitation if you registered to this event, and you'll be able to register and start starting on July the 1st. So please remain reassured that you will be able to participate. But anyway, Ana Artigas, our communicator, is sharing the links in the chat box. So if you wanted to copy it. Our next panelist is an experience that was developed in Venezuela. This experience will be presented by two people. One is Dr. Marisol Alvarado, who, in the name of the Ministry of Health of the Republic of Venezuela, will tell us how PAHO has worked with immediate contraception, post-obstetric event, and the technical collaboration with PAHO. Then we'll listen to Ariel Karolinsky, who together with Marisol Alvarado will present the contents that were covered in that course in the technical cooperation model. And they're going to tell us what happened since the time when this course was given in person in Venezuela. That happened before the pandemic. The last one that we did in person using simulation, previous training, exam, and then the clinical, and then with the patients. So Marisol, welcome. You have the floor. It's up to you to decide when you want to show the video. Ariel and Marisol, the floor is yours. Go ahead. Thank you, Rodolfo. Good morning. Thank you so much for giving us an opportunity to present the experience of our country in family planning, and especially the immediate post-obstetric event contraception. This started in 2018 when we wanted to solve the problems that we had with maternal reproductive health. And we prioritize the situation of maternal health in government. So the policy makers supported the strategy for the reduction of maternal and neonatal morbid mortality, and a strategic line which includes the all contraception. Here we have two guidelines. One is as outpatients in outpatient clinics, and the other is immediately after obstetric events. And we had the support of our PAHOM, and we monitored the results. And we have accompanied the entire courses. In our strategies of contraception, we always try to use this modality, and it's right based, because we need to improve the access, and that involves education with a right focus to move away from myths and to see this practice as a woman's and a man's rights. So without further ado, I think that the distribution of input, the accompaniment, and all the practice and the advice of PAHOM, we want to thank them, and all the other organizations that work together that ensured our good results would continue. We have moved, we have made progress, although we are a bit stopped by the pandemic, but we kept the monitoring, and we still do it. The idea is to move forward with positive changes and further deepening those changes. That many of them have to do with the mindset and with the methodology of education and training. So, and now we're going to show the video for you to see a summary of what has been attained so far. So can you please show the video now before we resume with some final comments?
La mortalidad materna.
"49 specialists in obstetric and gynecology were selected by their experience, teaching skills, and fields of action." That the participation and certification implied the commitment to lead the training of other colleagues in their respective states. After the end of the first year, after 52 replicas of this workshop that included anatomic models and hospital practices with clinical simulations, Venezuela has 1,400 healthcare professionals that were trained in LARC and AMU, including many different sectors. So in the 14 sectors of the country prioritized by the ministry, this grew as a snowball. In order to ensure the procurement of medicines and supplies required for the implementation of the plan, the 31 hospitals in the 14 states prioritized received 357,216 units of 13 essential products to prevent or to treat the major causes of maternal neonatal morbid mortality. and especially through the strategic fund of PAHO distributed it to the priority hospitals, 101,000 UDs, 25,000 vials of medroxyprogesterone. Our main focus is to attract pregnant women and to try to identify them and to see our childbearing population, to give them access to the right of contraception and to enable them to plan their pregnancies and to sit down with the communities to learn about their requirements in the health field. After the first year of implementation and after 35,000 kilometers, 30,000 medical procedures were done following informed consent, including placing 15,000 IUDs, 5,000 implant, 3,616 vials of medroxyprogesterone, and we distributed material. When I was told that I could be placed a device not to fall pregnant again, I didn't think it twice. I made the most of it because I want to ensure a good future for my daughter and not to fall pregnant in the near future. We trust that the continuity, expansion, and sustainability of this plan will be an effective contribution to the reduction of severe morbidity and perinatal and maternal mortality. We want women to be in good health until they decide to get pregnant again. Most maternal deaths are avoidable. No one should be left behind. Marielle, well, thank you. Ariel, thank you. Well, I think that the video was self-explanatory, but from PAHO Venezuela, I wanted to congratulate CLAP for this initiative. And as usual, as always, you have our support for dissemination and implementation in the country. It's going to be a great input to enhance what's already being done with the ministry in Venezuela. This video was developed in late 2019, when we are about to finish the first phase of the plan. Now, I'd like to give you the results obtained in 2021, having after more than a year of pandemic. And I think that the most important thing to highlight is that we have succeeded with the teams, both national and local teams. We multiplied by 3 the number of interventions prior to the process. So today we have almost 100,000, not 35,000 as they said in the video, which speaks of the potential of the project. That is the increase in the number of hospitals. There used to be 18 and now there are 33 hospitals. That is 2/3, and we are working in 2/3 of the states of the countries. The other important thing is the online replications. And today we have a significant number of healthcare providers trained. But sustainability of the project has to do with a change in the clinical patterns of professionals, which is the most difficult thing to obtain.
This articulation to the sustained participation of the Health Ministry, PAHO, WHO, the Gynecological Society of Venezuela, and the financial support through Swiss cooperation. In summary, this is a very complex scenario in the country and in the world, in the region in particular, in the Bolivarian Republic of Venezuela. So having clear views, and committed equipment and health teams are key to achieve the goals set. So thank you all. We're always here. Thank you, Dr. Kaniski and Dr. Alvarado. Now, let us hear our two last guests who will share. Well, you've realized the effect and the strong impact of this training model, but now, as many stated in the chat, we will try to follow with similar validated contents and tutorage, but in a decentralized manner to bring this training to where it's needed, precisely to those places where Dr. Saruja has shown have less quality of care or access or greatest difficulties. So we will focus on that to provide support. Now we will listen to the representative from IBP, a consortium headed by WHO and many other organizations at global level who work on the best contraceptive practices. Let us now hand the floor to Dr. Addis May on behalf of IBP, who will refer to their views in relation to our launch. The floor is yours, Juan, for the video. Thank you. Good morning and afternoon. I'm the technical advisor of the IBP network. It's an honor for me to speak on their behalf. The headquarters are in WHO, and we work to disseminate and use WHO guidelines and high impact practices in family planning. On this occasion, with the launch of these two courses for family planning for the first level of care and the IPOEC course, I would like to add on to what the colleague said regarding the importance of this material for IBP management. The IBP network has a long history regarding good practices at global level in the ambit of family planning. And since 2013, hand in hand with PAHO and CLAP in particular, and also with consortia such as the LAC Forum, we have worked in this ambit in Latin America and the Caribbean. As a global initiative, the IBP network has championed the dissemination of WHO guidelines, such as the World Handbook for Suppliers. We support the creation of these courses because we're aware of how beneficial they are for the region and beyond Latin America, for other regions in the world where we likewise work. It is an honor for us to participate, providing strategic advice and technical advice to our partners for monitoring the implementation of the course of family planning and follow-up of the tutor training course for the practical hands-on course of COEC. This is an opportunity for learning in our network, so we thank CLAP for championing the implementation of these courses with a view to replicate them in other geographical contexts. Without further ado, I thank on behalf of IBP for inviting us to participate as an active partner in this initiative that is not only innovative, but also reaches us in a very timely way for family planning in Latin America and the rest of the world. Thank you. Well, IBP, thank you so much. On behalf of our colleague, and I want to tell you that we have a very high number of participants. We have over 1,000 people connected, both via YouTube in the 3 languages or via Zoom. We're very sorry that some have not been able to enter due to the excess demand in the Zoom platform. We apologize for that, but this will all be recorded so everybody will be able to listen to it. There's a lot of energy in the participants, but also in the comments we've read and questions that we will answer. And now our last panelist. We wanted to end this analysis of the possible impact of our courses with a vision of a young person, somebody that not only represents young people and their contraception needs as users, but likewise Dennis Glasgow represents trainers for young professionals. Dennis, I want to introduce him from the Caribbean, Dennis Glasgow, who will speak on behalf of the youth group receiving special training in sexual and reproductive health. And he'll tell us of his vision as a young person, I repeat, but also as a young professional. Dennis, the floor is yours.
Buenos días a todos. Mi nombre es Dennis, soy de Guyana. Trabajo principalmente con la salud de...
I'm Dennis from Guyana. I work with sexual and reproductive health.
Sorry, I'm listening to the translator. Por mi contribución de hoy, hablo en inglés.
Today, I will speak in English.
So thank you very much for PAHO for allowing me to have this opportunity to present. As a young person, I think it's very important that we have guided conversations with young people on issues like family planning in the Americas. Young people are integrally a part of our healthcare systems, our family units, and ultimately our communities. Many of these young people go on to build their own families, some sooner than others. Some of these young people, as I mentioned, head directly into the medical profession. So this information is going to be very important for them as well. While it can be attributed to the fact that many young people become parents early due to the lack of comprehensive sexuality education and the lack of guided conversations on matters such as family planning, from the people we interact with mostly, that's our families or school, and of course our healthcare system when we go for regular checkups. It's important, therefore, that we ensure that the persons are adequately trained and prepared to facilitate those conversations at the medical centers, especially young medical practitioners who can better relate to their peers when we access care. Teenage pregnancy is still very prevalent in the region. So if young people are getting pregnant, then it's important that we talk to young people about family planning. And who best to do this, especially when they're young health practitioners at facilities to help guide this conversation. The aim is to have every pregnancy in the Caribbean one that was planned for, and the Americas by extension, especially as we adjust to life during a global pandemic where livelihoods have been affected and economic opportunities have shifted. It is commendable that PAHO has developed this course aimed directly at physicians and midwives in hospitals, assisting pregnant women at the time of delivery, and of course, women undergoing abortions. Healthcare providers need to be equipped with the right knowledge and skills needed when dealing with young people, especially young pregnant people. We have been judged by healthcare practitioners before in the past, and we've had many issues where confidentiality has been broken across Guyana and even the Caribbean by extension. Therefore, ensuring that healthcare providers have more scientifically accurate and factual information to share with pregnant women, this can ultimately minimize their inclinations or some of their inclinations to impose their morality and religion on young women accessing care. The family planning for first level of care course takes the content of the global provider manual, which provides clear, up-to-date information and advice that can help providers meet the contraceptive needs and for that client in choice. In working specifically with young people in Guyana on issues of family planning and to the Caribbean by large extent, I believe that young people do not have the adequate knowledge on contraceptives. Even young people headed into the medical field as first-year medical students, sometimes we're not always equipped with information on contraceptives. So in Guyana, we did a situation analysis on adolescent pregnancy in Guyana in 2018, and this reiterates my suspicion. So many of these young people interact with healthcare systems at various levels, either as care providers or as persons accessing the care. Some even become pregnant and they have to deal with care providers. So I believe that this course will be beneficial not just for the young people accessing the care, but young people that are actually training to become doctors or nurses or care providers. because it's important that all young people have access to information and advice that is scientific and factual. The advice that is given to young people can definitely impact the rest of their lives and ultimately future pregnancies. So it's important that we have this conversation. Lastly, in preparing this piece, I reached out to a few friends of mine who are medical students, and one of them had this to say when I asked her why is it important, or why would this particular course be important for persons accessing care. And Shani, who is my one of my colleagues in PAHO Youth for Health team, she said that these topics are very sensitive for women and impactful in their lives physically, mentally, and emotionally. It is important for healthcare providers to be reliably informed so that they can correctly guide women through the process of pregnancy or abortion. Healthcare providers should be able to equip patients with the accurate information needed to make decisions and reliably answer any questions raised. Most importantly, they should be informed so that they provide healthcare at standards recommended by WHO to ensure optimal health of that patient, end quote. So I commend PAHO and all of the partners who would have come together to ensure that this course became a reality and it's going to be well executed across the region, Latin America and the Caribbean, of course. So for all of you who are heading into this course and all of you who will benefit directly from this course, it's important that you keep young people in consideration in providing care, especially once that information is shared with you. Young people are accessing care and young people demand to be treated like young persons who can make informed decisions. So in doing so, let's ensure that every pregnancy is one that is planned for, and all young people, especially those in the medical field, can provide that support and that and the scientific information to other young people accessing care. And I thank you very much for your time.
Thank you, Dennis. Thank you for your participation. Now I understood why we needed to have the view of a young person, because they're so used to living with mobile phones. I think they were born with them. So they will likewise be the main users of these courses to train online our colleagues in the region. So having said this, we close our panel and hand the floor to the director of CLAP, Dr. Saruja, that will help us close. Suzanne, we had over 1,000 people following us. This is a record webinar that has proven to awaken interest in the region. So you're invited to close. Thank you all. Thank you, Rodolfo, and each of you, the people listening to us in particular. We need to have the best response to health needs. Each time we provide care to women, to a couple, to young people in particular, teenagers must be aware of everything that may be done for these people in relation to healthcare. These two courses, as Rodolfo said, are quite different from the online courses you are aware. We have animation, interactive parts, and tutors. It's the first time that we launched this methodology.
I invite you not just to see the modules, but also to disseminate them. As is usually the case in YouTube, we don't have a CLAP channel, but it belongs to PAHO. But please register in the channel, disseminate the video so that more people will have access to the courses. At the Latin American Center for Perinatology, we designed a number of tools that are very useful and that our NGOs are also collaborating with. So I wanted to thank all the record of audience, and I hope that many of you will will join us in the future. I read in the chat that many people are congratulating, and I thank you all, and I thank all of the panelists. And I want to thank the people on the other side of the counter, because in the room, and now I wanted to invite all Emma, Fernando, Ariel, América, to open your cameras to take a picture, so that we can take a picture. And I wanted to thank each and all of you. You are incredible partners who work tirelessly to disseminate. I see Dr. Alvarado is there together with Ariel and others, and we have an entire team working behind the curtains, the translators, the people that coordinated this, Ana Artigas, who's the journalist, the communicator responsible for these meetings, and a number of partners, and especially Rodolfo. Thanks again. Muito obrigado. Gracias, because I think that we are taking very good resources to the region, making them available. So congratulations to all of you.